I was.
That's pretty freaking close. What's up, Richard?
Some
Now what happened?
And to talk to people and everything. Both of them work together.
There we go. Well, I was in that seat all day yesterday. I'm give out.
Got one more day, Sheriff.
I had to come back home. I was give out. But them new chairs are nice, ain't they?
They are.
They are
We were
nice.
talking about that a while ago.
They done styled y'all up.
Yeah. Richard.
Yeah, but he wasn't there.
Right, okay.
Yeah. Do we have quorum or we need?
6 here, yeah. Hey,
Morning, Sheriff.
how's it going?
How are you?
Good. Good to see you.
Good to see you too. You here?
Keep looking back.
On the end.
None of y'all count. You don't count. We're good? Absolutely. He has assured me we will be done in record time today.
Yeah.
Is that what he said, sir? What he told me.
You're the one on the meeting, sir.
I can sit on it.
Yes, I'm understanding. We had the stuff changed, but we had the release.
Coming up. Yes. Yes.
Press release, class action.
Or something. The fact that she's included. Well, that's Texas. TCJS, but, you know, and it's what I explained. There's folks asking about, should they be looking at some statutes or something?
Time to probably formulate that response.
Two, really isn't a mechanism for enforcing something. Release from the county jail.
I thought Benny had nothing between his eyes.
So if they destroy.
This dog.
Don't calculate.
Good too.
That's political.
Sure, she wanted to go on Hollywood, I'm sure, because she.
I have my work phone doesn't
Yeah, terrorist strike.
text.
Lord knows where. I have no idea. I have no idea where she went yesterday. And it's gone for the lunch.
I said, TDC is. Even if they come and get the person, they're not going to door the house there.
Okay, this was recently. It was filed 3 years ago.
Especially if they don't.
And
It's in the frame on the desk.
pay for it.
she like,
I mean, I think, yeah,
We filed in 20.
I don't know.
that's what it's pertaining to.
Well, I thought we had talked to my dog when I'm off.
On the case,
See how.
It's not. I think it's
it's also, I don't like really go back and get a face. It's so crazy.
Of course, I don't, who told me?
Because we connected with the plaintiff in 2020, waiting to go for competency investigation.
She's sweet.
And
He literally, he was not
back,
2 year mark.
Have you had her fit?
and after a few
But I
months,
have you.
back,
10 years.
we heard from her.
Some percent.
Two.
I took the plea. And today he took the plea.
Nice.
She.
Good. Do you have Janice?
All this stuff
You call her and see if she's
over the time.
in town or if she's going to attend virtual.
And then he, with
We have a quorum, I just,
days,
she's usually here, so I just curious.
Expensive.
logic was that, I mean, they what they thought. They don't know, the chief picked up on this meeting. They have to step 15. But this is just a sort of a assumption that if it's not county jail time, it's TDC jail time, whether it's state jail or whatever, they have to actually go out or they. And okay, so why haven't they gone there? Well, there's an issue with the packets. So they get a number. And once you have that, then you have to get.
Hey, Jana, this is Jason with the Jail Commission. We will make it to the ARAC meeting or tune in to Zoom.
Yeah.
Just let us know as soon as you can, please. Thank you. Bye.
His attorney.
Nice. Go.
Good
morning, everybody. It's 10:02 on this Thursday, the 9th of April, 2026. I'd like to welcome everybody here to Austin, the Sheriff's Association of Texas headquarters. Thank you all that are joining us online. If you're having any trouble, let us know hearing us or whatever. I'll move to item number 2 on the agenda, which is the roll call.
Sheriff Rowe,
I'm present.
Sheriff Dickey. Here. Sheriff Cass,
I'm here.
Sammy Farias, Jana Pence, Lori Compton,
Here.
Gary Pinkerton,
Here.
Carolyn Crane,
Here.
Chris Gundu.
Here.
You have a quorum.
Thank you. Item number 3, reading and approval of the minutes from the meeting conducted January 9th, 2026. Does anybody have anything in the minutes they need to discuss and or modify?
Kelly, I think, did I see the meetings? It says January the 9th. Wasn't that January the 8th? Richard, was that the 8th that we showed?
Let me make sure.
I think that's all I saw.
Yeah, it was the 8th. Thank
Okay.
you.
You're welcome.
Yep. Well, it says it's correct on the minutes.
Good, good,
It's just that the agenda is off.
good.
It is list January 8th, 2026 for the meeting. Okay, anyone else? Hearing none, I would ask for a motion to approve the minutes.
Yes.
I have a motion. Do I have a second?
Second.
Got a second. Any other discussion? Hearing none, I'll call for the question. All those in favor signify by saying aye. Aye.
Aye.
Aye.
Any opposed? Motion carries. Item number 4, public comment. Have any public comment?
I don't have anyone signed in person for public comment. If you're here for public comment online, if you can use the raise hand feature. Let me know you're here. So it looks like Dr. Robinson's.
All right, Mr. Robinson, you're welcome to proceed.
Awesome. Thank you, everyone. Good morning. My name is Dr. Mark Robinson. Thanks for the opportunity again to speak and the consideration of the rule suggestions that I submitted. I know you all have a huge amount of work to do, and so thank you for taking the time. I'm just going to speak for a minute. I know you all are busy. I'm an inpatient physician in Houston, Texas, who cares for incarcerated patients in the hospital. I'm here speaking on my own behalf. Last time we discussed the proposed changes to require a mechanism to contact families in the setting of serious illness. You all raised some great points about security issues, informing them in a way that are applicable to all the types of jails in Texas. I think there is some low-hanging fruit and some common sense rules that we could come to, especially requiring urgent family notification around deaths or intensive care unit admissions where minutes matter for family to get there in time. I was actually recently at a correctional health conference a few weeks ago, and this is an issue all over the country. But I will say we do lead the country in actually having a commission that sets jail standards. And I really think we could lead the country on this. So I'll be here for the meeting in case I can be helpful in any way. You all are the real logistical experts here. Thanks again always for your time and your hard work on this.
All right, thank you, Doctor. Do we have anybody else that's online? I see Audrey Nath. Please proceed.
Yes. Sure. Hi, guys. I'm Audrey Nath, neurologist in Houston. First off, thank you so much for giving us the opportunity to speak. I just wanted to say that I will have this on the agenda during this meeting about the need for a seizure protocol in our jails. I had initially gotten involved in this like a couple years ago, seeing media reports of seizure deaths in jails, and I'm an epileptologist, and seizures are preventable. So I really look forward to discussing, working with you guys on a seizure protocol, and thank you so much.
Thank you, Doctor. All right, anybody else? Their hands raised. All right, seeing none, I will close public comment, move on to item number 5, old business A, 259.132, exercise area. Director Armstrong.
So we've been looking at this exercise area and trying to get the wording where it's a little more understandable. We're going to have maybe a third or fourth attempt at it. I'm not sure. So what we have presented for you today is here one or more secure exercise areas shall be provided. Where outdoor exercise areas are provided, alternative areas shall be available for use during inclement weather. They should be covered with security enclosure. Where outdoor exercise areas are not provided, facilities designed shall ensure access to sunlight. A toilet and drinking fountain shall be readily available. Exercise areas shall meet the minimum size requirements. Facilities under 100 inmates is 800 square feet. Larger facilities, 15 square feet per inmate, but not less than 1,000 square feet per area. Multiple inmate segregation areas, 15 square feet per inmate, not less than 500 square feet per area. And single inmate segregation areas, 200 square feet. Each direct supervision housing area shall have an exercise area nearby which should be adjacent to the housing area. That's the new language we've come up with to try to clarify it. Open for discussion.
Just for clarity's sake, explain where the section is, alternate areas shall be available for use during inclement weather, how that would.
It's what your day rooms are usually, your multipurpose rooms are for. If you have rain for a whole week, you still got to provide rec of some sort. That's usually in your recreation plans, how you do that. Some of them do it in themselves with some videos or out there and directing calisthenics or something, but that's all it is.
Just wanted to be sure what we're talking about is an acceptable alternative. Then.
Right.
Otherwise, could have some pretty tremendous impact. Talk about an indoor recreation yard. Does anybody have any questions, comments on recreation? On this rule change?
Kelly, I think we looked at this last time. Ricky, this will work for smaller jails. This will work, no impact on the smaller jails. This is just trying to remember.
Yes, sir. They haven't changed anything. We just changed the wording.
The
wording, size of the recreation areas and everything else, none of that's changed.
Okay.
We just tried to make it a little clearer as to what we're expecting and what we're needing in the recreation areas. I think our architects and people like that understand where we're at and that we haven't had any issues with them. It's just clearing this up for our jail staff and our administrators to understand what's being talked about.
Okay. Yeah, I see it on the back page of that.
Any other questions, concerns? We need to take action on this.
Yes.
Okay.
If Rob, may I ask a
Yes.
quick question? Is there any rule for outdoor time? Like, are people required to be provided time outdoors?
Not outdoors. There's a rule that says you have to have sunlight, but there's nothing that says you have to go outdoors.
Well, yes, so the sunlight.
Sunlight, yes, there is a rule for sunlight separate from this.
Separate from this,
Yes.
okay.
All right.
I move that we recommend this to the full commission.
And this will be for advancement to
Public comment.
public comment on public registry. Do I have a second?
Second.
Got a second. Sheriff Cass. Any other discussion? Hearing none, I'll call.
I just want to say thank you to Ricky and his team. Not only did I make it hard on them in the meeting, but then we had 2 or 3 phone calls to go through it and wordsmithed it 10 different ways. So thank you.
Pretty good. Appreciate that. Any other comments? Hearing none, I will call for the question. All those in favor signify by saying aye. Aye.
Aye.
Any opposed? Motion carries. Item number B, guardianship rules, 265 admission, 267 release, 273 health services and plans.
For our last meeting, we discussed we were going to try to get these onto the commission meetings agenda. We were unable to get that accomplished. So just keeping it on the agenda as a reminder, it's still there. It is on our agenda for the May meeting. It will go to the board for public comment. All those rules, 265, 67, and 73 are being changed due to the guardianship. So we're not changing anything else in those rules other than what the words we have for guardianship, the language we have for guardianship being added to that. We did have a really good meeting yesterday with a judge that was very familiar with guardianships, and he gave us a lot of good intel and good information. These rules were sent to him this morning to review as well. If he has any possible changes that he thinks we should make, we will get that out to you and try to get all that done before the May meeting. If he does or doesn't, they're going to go to the May meeting. I think we should. I'm not going to say they're going to, up to y'all. I think they should go to the May meeting and be presented for public comment on whether or not we get them changed or not, because we can always change them after public comment with his recommendations as well. I think we should go ahead and get that process started because it is such a long process. That's the plan at this time. It's on the agenda for the May meeting, unless you want to change that.
All right, so no action unless anybody wants to suggest a change there. Going online. All right, item number C, 4-year rule review, chapter 289 work assignments. Director Armstrong.
So 289, I don't get it here. I don't think we've changed anything in it. It's ready to go. Yeah. So 289 is ready to go to the full board to be vote for readoption. 291 is ready to go as well to vote for readoption, but we do want to pull 291.2 for some possible language. And that has to do with communication. Mail is the main one. We want to add electronic in that. So we want to pull that so we can work on some language to bring back to you. 291.2. Page 23 in your book. 291.2, we just want to add on the very last sentence to include electronic communication. So we can include the tablets and emails and stuff such as that to this standard.
Where would that word change be included?
Under 291.2 at the very first paragraph.
Okay.
At the end to include electronic communication.
Anybody have anything else to add on that?
And if you're all right with that wording, we can go ahead and send that.
I was fixing to say, can't we
as
just?
well with that change.
Is that all it is? I mean, with that, that's all it is.
That's all we have. We looked at all the others talking about it, but I think if we change, just add electronic in that, everything else will fall into play. You don't have to add in the other areas because it's already.
Do we need to take action on item C before we move to that? I mean, has that already been recommended for public comment or?
No, that our recommendation is to send 289 and 291 for readoption. So that's the recommendation, is take action on that, pulling 291.2.
Well, those are separate agenda items, right?
C and D, but they're both going for readoption.
Okay. Well, so would it be okay if I make a motion to, on item 5C, to move that chapter 289 be readopted as written?
Okay. You heard the motion. Do I have a second?
Second.
Got a second. Any other discussion? Hearing none, call for the question. All those in favor signify by saying aye.
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 Any opposed? Motion carries. Need a separate motion to 291.2. All right, so we'll need a separate motion to add the language and move it forward on the full commission for public comment. So I'd ask for a motion to approve the change and push it forward.
I make that motion to approve that change for readoption. And Ricky, will you read the change again for the minutes?
Sure. Each facility shall have and implement a written plan approved by the Commission governing inmate correspondence. The plan shall provide for the handling of privileged and non-privileged correspondence, both outgoing and incoming, and shall provide for the collection and distribution of correspondence to include electronic correspondence.
That's my motion.
Do I have a second?
I'll second.
I heard a second. Caroline, was that you?
Yes. Yeah, it was me.
Okay, making sure. All right.
Yes.
Any other discussion? Hearing none, I'll call for the question. All those in favor signify by saying aye. Aye.
Aye.
Aye.
Any opposed? Motion carries. Item E, public petition to minimum jail standards.
This is the public petition that was discussed at the last meeting to be sent to the commission, and the full board sent it back to us to work on it. So, or discuss it and see what we want to do with it. Dr. Robinson spoke on it in his public comment a while ago, and He's online if we have questions, I guess, but we want to have, oh, you mentioned some subcommittees possibly. Do we want to have subcommittee kind of get together, maybe work on some language with us on this to see what we can do with it? Well, what's the pleasure of the committee for this public petition?
Well, and just to be clear to Ricky's point there, as we have operated so far, most conversations about everything having to do with either changes or adoptions of rules, modifications, so on and so forth, has been a fairly open process. Unlike the specific taskings we have in the IDD advisory committee and in subcommittees that were established with that. And as we've begun this mandatory rule review, 4-year rule review, which has got us talking about every standard top to bottom, the first, we spent roughly the first little over a year now, maybe behind 2 years, mostly discussing a lot of things, the standards related to construction requirements, those types of things like that, which we knew for the most part, outside of using some outside entities, architects, fire marshals, and some of that truly understand those requirements. They did the lion's share of those reviews to ensure we were still compliant with either certain fire standards and or, like I said, modern construction and engineering standards. As we are now starting to migrate fully over into operational standards, I, for one, recognize that these standards are the ones that potentially drive a lot of discussion and a lot of consideration and whatnot. So in preparing for today, my thought process was to potentially look at breaking off into some subgroups to examine these, potentially suggest modifications, changes, whatever the case might be, during the times between our actual formal meetings here. And I'd be interested to know what everybody else thinks about that idea. Again, either way, we always want to be respectful of everybody's time when you come down here, and we can obviously make adjustments. We can turn these into far more lengthy workshops, or like I said, we can have work happening behind the scenes. As we've done historically, also, for most everybody that's been on this committee for a length of time, we've also handled things in a lot of ways, somewhat jokingly referring to homework. So, be sure and review your homework, make your annotations, your notes. We can still continue to go down that path. But again, my main concern is just making sure that we are prepared and ready to push forward recommendations, particularly where key changes may be, so that we can administratively process those through this group, push them forward to the commission for whatever appropriate action needs to be taken, whether that's like we've already done so far this morning, pushing some changes up for public comment, or for ultimately review after public comment and pushing back for ultimate adoption. I'll remind everyone that, and especially I know we've got some newer members that have joined us. After the sunset review took place, one of the things that changes, it was kind of represented a whole legislative shift with regard to state commissions. Historically, in order to change a standard with regard to the jail commission, it would have required a statutory change to force that to happen. They have granted each of these commissions the authority to handle and make modifications as necessary, basically take care of their business. And we saw that because both the jail commission as well as TCOL, our licensing agency for law enforcement, corrections, communication, so on, also got similar instruction from their ultimate final sunset review and recommendations. So we, the commission now, has that authority to make significant and/or key changes to these standards, like I said, without having to have that legislative or statutory piece, driving that issue forward. So again, and I just come back to is we're now really migrating into operational rules. This is where I think, like I said, we're going to have the greatest amount of conversations, discussions, and a lot of public input as well. Because go ahead.
No, no, Sheriff, I'm sorry. I thought you was finished.
I am now. How are you? No, I'm done. Go right ahead.
No, I was just going to say you're exactly right. In looking at these, thinking about these, Doc, thank you for, there's so many variables in this and there's so many jails, the different sizes of jails all across this state. I mean, what, Ricky, I don't put you on 180 something, 190 jails, and trying to get, looking through, trying to get procedures for family notifications, procedures for what they're doing in the ER. I would say that probably a lot are doing a lot of different things. And, my facility is a medium-sized facility. It's nearly a 200-bed jail. And, I might do things different than Kelly's or someone else's, but in all of it, you try to put the best thing you can do forward, and then the common sense of what you can do. And the medical staff may not see the side we see. And so, you have a conflict immediately there. So I think it's going to take some, and just looking at these procedures, we talked about it last time, just looking at what we can manage in our jails when we have inmates outside of those jails, and manage that safety net wherever they're at. It's going to take some hard look to figure out if we're going to make a rule that says this is what you'll do every time. There's so many variables. I mean, and without the staff knowing the behaviors of those inmates, it's, you say, hey, we don't want these inmates shackled, for instance, because this has come up in our ER. Well, you don't realize what we've just done trying to secure this inmate or what problems he's caused. So it's going to take some talking. Kelly, in my opinion, it's going to take some looking at that pretty hard.
Well, and I don't disagree. That's always been a fundamental principle since this committee was formed, was to remember that when we are talking about jail standards, they are minimum jail standards designed in their very way to be as applicable as possible to all facilities, giving all of the deviations. The total number of jails, there's no two jails in Texas that are identical. Whether that's in design, whether that's in operational philosophy or policy. And, again, it's always a good reminder to everyone here that when we do look and examine these standards, that we are keeping that central in our mind, that we've got to make sure that any type of significant change has to work in a 10-bed jail, has to work in a 200-bed jail, 1,000-bed or bigger. That's always the central point on these. So I appreciate that part. We don't have to beat this up too much. What we can do, or what I will do after we conclude today is I'll reach out individually and see who's willing or might be willing to want to take on some specific areas that we have on the schedule coming up, and we can kind of move forward like that until we can get all of that established, if everybody's in agreement.
Yes, however we can help you, my jail admin can help either way, Kelly, whoever you need to put together.
I appreciate that. And like I said, that's just the key is that, like I said, when we kick this stuff out, to keep it moving, keep it timely, and stay within the required schedule we have to do to meet what the state requirements are on this. I have to encourage everyone and certainly appreciate everyone's willingness. I know when you go back home, you get greeted with everything that's back home. Work is there. And so this is, we're asking you to do stuff above and beyond, but everything we're discussing in here has a direct impact on everybody that has any type of responsibility over a jail or detention center. So we'll work out the details on kind of trying to split this work out and how that'll get distributed. And as always, every member will continue to get the material that will be on the next upcoming agenda, so that have the opportunity to take a look at it, make any notes or any possible recommendations.
Sheriff Romeo?
Yes, go right ahead. I was just about to.
And you weren't here for the last meeting, and there isn't that much detail about our conversation around this, the recommendation that Dr. Robinson made. But I think at some point, we landed on this question of like, we don't even have a rule for notifying when there's a custody death. I mean, I understand what Sheriff Cass is saying about security concerns when people are in the hospital, which is what the rule recommendation was about, is that physicians are frustrated that they can't reach out to family for critical care decisions. But then we realized there wasn't even a rule for custody death notifications. And I'm assuming there's not a problem after somebody dies. There's no security issue to make a notification, and we don't even have a rule for that. Could we at least like have that floor level minimum standard that there should be a process and a protocol for notifying, which we don't have right now? Could we at least start there?
Certainly willing to, we can ask the staff to, potentially draft some language to discuss, unless you've got some ideas on some specific things to take a look at. I don't disagree. I know there's not a specific rule that says it has to happen.
Right.
That's just, I would ask either of the two other sheriffs in here that, it's typically well established that, when law enforcement has a death, whether it's in custody or whatever the case, law enforcement makes those notifications appropriately. But again, there's not, to your point, there's not something hard and fast in there. That's just established practice.
Yeah, Chris, it may not be a rule but it's a practice. I think as all law enforcement agencies practice, and that's inside a jail or something we're working outside of that. Tell me what you're thinking on this. Do you know about, is there no notifications being made, or do you have something that you're thinking about that hasn't been done? Or is this a problem, Ricky? Have you had this to where someone's made these complaints that I just can't imagine somebody not notifying a family member?
I have no knowledge of complaints coming to us that nobody was notified. I'm kind of with Sheriff Cass and Sheriff Rowe that I think jails, I'm not gonna say all of them, because I don't know, but most of them I think are going to notify because they've also got property that they have to dispose of. They have to contact the family members, the next of kin to release this property to as well. So they're notifying them at some point. I don't know when it is. The notifications are being made.
Well, and just for clarity, is this a lot of this coming from the out-of-state housing? Because I know that's been brought up quite a bit. That there was concerns of.
I mean, out of state, we don't even have any control over medical care. No, I think listening to what Dr. Robinson had mentioned last time, I think one of their frustrations was that when somebody needs critical care, or they're on life support, or they're in a coma, or when it's that level, before death.
Well, no, I was only specifically talking about the death notifications.
No, it started from this.
I know where,
conversation,
I'm tracking you there.
But the death notifications out of state, there were 4, we know of 3. The notifications were all very different in all those cases. But even within state, we've just been talking recently about a case in Dallas that, you talk about property, they just put the property in the ambulance and send it off. And it's not even being counted as a custody death because there's all this technicality of, well, we release the hold from the other county. And so I think there's a patchwork of, I'm sure there's a practice and I'm sure you all notify, but I think it's very different the way it's done in different counties based on the situation, especially if it's with this confusion of custody death in a hospital is maybe not a custody death anymore. There's sometimes the hospital calls and sometimes the sheriff's office will inform. There's no standardized protocol. I appreciate the practice. I'm sure there's a practice. I think everybody at this table said last time that we just do it. There's 244 jails. It would be nice to have a standardized practice.
Well, I think that that's an important part for the sheriff and the chief jail administrator to be involved, because basically in Smith County, if there's a death in custody, we will notify the next of kin, but we also send a chaplain with us. And normally one of my lieutenants or myself will do the death notification, and we explain to the family what goes on. And it's been successful with us.
Yeah. And like I said, those are practices that probably every jail does something in that similar manner or fashion.
That's why we have minimum jail standards as well, right? Because all jails are so many different sizes. Some jails don't have chaplains. So we don't try to get into describing the procedure of what the sheriff's going to do. We don't tell the sheriffs how to manage their people and run their jails. We just have minimum rules and have you tell us how you're going to do it. So we don't want to start getting into telling the sheriff how they're going to do things. We can make a rule that you have to notify, but it's going to be up to them as to how they do that.
Yeah, I'm in agreement there, because again, that's wide and varied. That's what Gary Pinkerton's talking about there. That's really above and beyond. And I couldn't, relatively confident that there's not a whole lot of jails go to that extent on something. Now they may do them in person.
Yeah.
But it depends on who they're going to, who gets sent out there and everything. But yeah, you're getting into the neighborhood of you got to be very cautious on how far it goes, but then making sure the notification happens. Absolutely.
I would be interested in seeing something actually prior to a death in critical care. This is where you hear a lot of stories at the jail commission about people being on life support or in a coma, or the only reason the family was notified is because they were an organ donor or needed to sign some paperwork. And so I'm more interested in actually the pre-death.
I think we can come up with some languages, like Sheriff was saying. Let's get into a subcommittee and let's work on some language. But we're going to have some heavy involvement from the sheriffs as well and the jail administrators, because there is some security concerns. Even if somebody is in ICU, there still may be some security concerns. Maybe not that they're going to do something. Maybe somebody can do something to them. So there's different concerns we got to look at to be careful with. So there'll be some in-depth conversations, I think, over this policy. But I think we can maybe come up with something. We just need to get a smaller group of professionals and people like you or whoever else wants to help and narrow this down.
Sheriff Roy,
it might.
Are you thinking about the subcommittees like in the IDD?
Mm-hmm. Yeah, but we've got to kind of come up, those were kind of specific in one way. These, we've got to kind of think through how the order of that would work, because the material's different. It's not like data collection and training. This is about splitting up based on the schedule, of rules to review. That this group would have this section, this group would have this section, so on and so forth would be where I'd go. That's why I said I need to kind of put that together and kick that out to everybody to kind of take a look at and see how that would work. Or how it worked best anyway. So, so staff's gonna just work on some language for death notification currently.
Just death notifications?
No, you can expand it out. No, expand it out.
Okay.
I think Dr. Robinson broke it down here in his proposal, the three things. I mean, if they've been hospitalized more than 7 days, admitted to ICU, undergoing anesthesia, or entering hospice or end-of-life care. Those seem like a good place to start if you're looking at death. No.
All right. We'll follow back up. I'll follow back up with everybody after today on how we'll progress forward on that. So, and you guys work. Item number 6. Pause there to make sure I had my Roman numerals. New business, item A, chapter 297, and that's broken down all the way. Do you want to handle those individually or?
So are we gonna procedure plan in this other one?
Oh. Procedure plan. Well, sorry, I did skip right past that. Well, with regard to the seizure plan, and having had some conversations with our vice chairman, who's a medical doctor, a couple of things are clear on that. One is that's something that we need to probably actually involve some subject matter experts on. We need to have doctors talking about it. I jokingly made the comment that as a former jail administrator or person in the position I'm in now, things you learn early is don't get, try to overstep when doctors give orders and give instructions. So I think it's something best left for the doctors for us to get some of those together and go through that. In its current form, I've got in terms of the recommendation we have, the public recommendation we have for this, and again, in some of the conversations I've had so far about it, I've got some concerns there based on the advice of Dr. Porsa that remembering that when we're talking about operations within a correctional facility and dealing with the types of treatment that are recommended here, the fact that we're dealing with controlled substances and potential that a vast majority of our jails don't even would have the appropriate level of medical staff to prescribe and or administer those medications. Again, it's why I come back to the fact that really rather have some of the doctors kind of go through that and make sure we're staying within or any future discussions are staying well within current legal requirements. So, but I can follow back up with Dr. Porsa on that and see if
Do you want us to reach out to some of our local correctional medicine vendors and see if they have any doctors that are willing to participate in conversations about this?
Well, and that's, and that was one of the key points too. And I think that is a good idea that we talk to them because there's quite a bit of difference in the delivery of medical services inside a correctional facility versus in a clinic or hospital type setting. And those individuals are much more familiar with that type of medical delivery. So, yeah, I think that would be the best thing to do on that. I don't want to put it to bed by any stretch completely, but I think we've got to tread carefully with this one.
I think you're right, Kelly, and I appreciate the docs. Jails deal with this every day, and I don't want it to think that. And as you're here and you're talking and you presented it, and we appreciate it, but we do deal with this constantly. We deal with We deal with medical issues. And it's becoming more and more medical. I'm sure you're seeing it in your, I'm sure you're seeing it in your hospitals as well. But Kelly is right on. When we look at these, what Harris County can do is not what I can do, and what I can do is not what um, maybe Delta County can do. I'm just throwing out these different positions, but medically responding to whatever they have to do medically, and then we rely on getting those individuals transported if need be or to a care facility. But remember, there's some facilities that the nearest care is a long way. I'm fortunate to have nurses and nearly 24-hour coverage. Even my jail at 200 beds, I've had to, as a sheriff, I've had to think outside the box and make positions and use positions for nurses, LVNs, to try to um, add to the doctors and the nurses that we have on contract to be able to get the care as we can 24 hours a day. That's probably most jails. Well, here's Ricky. He can probably tell you most jails don't even have close to that. There's some jails that have it 24 hours a day. So I I do appreciate it, and I do see I do know that what you're presenting is what you're concerned with, and we are concerned with. We don't want it either. We want to make sure everybody's good and taken care of, and we hate even the death notifications. They're tough to do, Chris, and but I feel confident that they're getting done. But I think, like Kelly said, this is going to take some looking at to make sure that before we say this is what you're going to do, that it's going to fit a practice that's able to be done, in my opinion. And especially when you got to remember you're dealing with, in a hospital setting, you have LVNs, RNs, you have nurse practitioners, you have doctors everywhere. In a jail, I've got 18 to 20-year-olds running around with no letters behind their names.
I don't disagree. Go.
Sorry, if I could just add, I think these are all really great points, and I really agree with Dr. Porsa's thoughts that, administering controlled substances takes a lot of clinical judgment, and that might not necessarily be appropriate for someone like Sheriff Cass mentioned, 18 to 20-year-olds who are kind of in charge of the jail when there may not be any medical professionals around. I think beyond seizures, this highlights more of an issue with kind of medical emergencies in general. And like Sheriff Cass said, many of these jails, like his own, are pretty far from emergency medical facilities or hospitals. And so it kind of raises a broader question of what do you do when someone does have a medical emergency? Do we trust 18 to 20-year-olds running the jails when none of the medical professionals around? To recognize and respond appropriately to medical emergencies, be it a seizure or a heart attack or otherwise. Because I think Dr. Nath raises a good point that these are all preventable deaths. And I think we all agree that we want these deaths to not happen. And so I think beyond just seizures, I think this raises the concern of how do we operationalize better responses to emergency care, emergency medical situations in jails that, both have 24/7 medical staff as well as those that may be a long ways from the nearest hospital.
Thank you. And also for everybody that has access to the board or the committee packet for today, on page 35 is an email that Dr. Porsa put together for us that goes through and explains his position and concerns as they apply to looking at this situation within a correctional facility, to everything that's been said prior to in terms of medical capabilities. So, but we will follow up with some additional doctors and get some input and have that ready for the next meeting.
Sheriff, a quick question.
Thank you, Sheriff.
Bet.
Did we ask Dr. Porsa to weigh in on the other recommendations as well? or just this one?
Just this one. We
He
can.
hasn't seen Dr. Robinson's recommendation.
I don't think that's just my personal opinion. I don't know that there's any medical concerns. That's why we didn't ask him for that. It's more of a security concern than it is a.
No, I was just curious because Dr. Corsa is Dr. Robinson's boss. So I was just.
Oh.
Well, he was intending to join us today or later this afternoon, but he thought it was yesterday. He thought the meeting was yesterday, so it was unavailable today. But we have one item that's there that was on a last-minute agenda ad, which is another request for public request for a rule. Basically, the petitioner is unsure of the code pertaining to over-detention issue, and the comment is to implement requirements that jails release inmates when they've completed their sentence. But that's all the more that this has. As Director Armstrong showed me this, and we discussed it, he's going to reach out to the petitioner and try to get a little more information on what exactly we're talking about there and or what their concern is. And then we'll follow back up on that one once we have a better idea of what context that's even applied, is pertaining to.
I think it comes out of the news articles that recently came out. I mean, looking at the date of this email, there were several news articles in the Texas Tribune and a couple of other papers about the class action settlement in Smith County on over detention. It was $1.5 million federal class action settlement that was approved because people were being over detained beyond their sentence times in Smith County jails. I think this is where it comes from.
Over detained on county time or TDC time or both?
Well, that's a question for Chief Pinkerton, I think.
It was on TDC time.
Okay.
Inmates that have been sentenced to TDC and a lot of state jail and waiting on the release order to come from TDC.
Okay.
But I can get more detail with you if that's where it's from.
Well, I've heard to Chris's point, I've heard about that issue there, and then Dallas County was also recently it was talked about on that. So let's get more information on the specifics of that, because I was asked about this a couple of weeks ago, and specifically pertaining to those that have been sentenced on felonies to the Texas Department of Criminal Justice. There's a potential that we might even have to get into some statutory changes, because once a person has been sentenced, they're to go to TDCJ. There's not a mechanism currently in place to release somebody from county jail on a TDC sentence, even if they've met their time. And we don't calculate time for TDCJ, though those figures are constantly in flux as to how long individuals may serve or how much credit time they may receive and whatnot. There was a program that was implemented back in the 90s called Parole and Abstentia, which was designed to help ease jail overcrowding before there was a lot of massive expansion on prison beds. But that law sunsetted out, I believe. Don't hold me to that. And there was even discussion about bringing it back up back during when we had the pandemic going and criminal justice system all but shut down. And there was no interest at the state level to reinstitute or reconstitute that program. So we're going to have to, let's get some details on this, and then we'll evaluate exactly how that may look. But TDC's, as long as I've been doing this, TDC has always said, even if we're going to release the person the following day, we're still going to come get them. We're going to process them, especially if they have been issued a TDC ID number yet. But that's been historically how that's always happened. So I'd be curious myself to get with Gary and look at the specifics of that lawsuit.
I think really talking about two issues, right? We don't know what this complaint's about. This could be a complaint about, their time was up at 1 a.m. and the state law says you can't release until morning. So, but with regard to the case with Smith County, and I don't know the details of Smith County's case, I'm just saying on that other perspective is that, if you have somebody that sits in county jail for 2 or 3 years on a felony and they get sentenced, and their mandatory release date, regardless of parole and absentia eligibility, if their mandatory release date hits, then we're at the mercy of TDCJ to either tell us to release them or come get them so they can give them a TDC number and release them. So we probably need to look at both. And not sure we can do anything about the second one. But
I'd be interested to hear what happened in
yeah.
that outcome of that lawsuit. So,
Because on the flip side of the coin, once upon conviction and once the PIN packet, as it's referred to, the penitentiary packet has been completed and submitted to TDCJ, they're then on the 45-day clock to get them.
I think here there was a pen packet issue. They couldn't get the pen packets out in time, so that's why.
That could, well, and that changes that changes the calculus completely.
And it was 102 people. That's why it's a class action. So it's an issue.
Okay, very good. But we'll bring more information back as soon as we can verify for sure specifically what she's looking at. Say she, the petitioner. Item number 6, new business and chapter 297. Did you want to handle those together or?
Yeah, all these is chapter 297. It's basically what the sheriff referred to earlier as your homework. This is the topics that we'll be looking at our next meeting to review and go over to see if there's any changes that need to be made. So all of 297. And just to give you some context on this, this is basically recently reviewed through Sunset and rewritten with all the new enforcement standards. I think it's fairly up to date. I read over it recently. I've asked the field guys to read over it as well. They couldn't find anything at this point, but please read over it, see if there's anything for the next meeting that you see and that needs to be updated, changed, or talked about to update for the next meeting.
Homework.
Yeah.
And then item B, 283.3 grievance plan.
So that is a topic we wanted to bring up and talk about. We ran into this very recently with grievances, and the grievance plan was kind of, so we have a new employee in operation plans, and as she's updating and learning and reviewing things, grievances came up, and we've come to find out across the state, not everybody's doing grievances the same as we think they should be done. So we wanted to put some clarification language into the grievance administrative rule about it. And we've also discussed that number 50 that's in there. So I think you have an insert.
So the last one.
That'd be the back page.
Okay, the very last page of your book.
Or no, 49.
Starts on 49 and then goes on to the back page.
Okay, so they're on number 1 on the back page. It talks about 50 capacity or less. One person may be this grievance board. So with reading that, you just kind of assume that all the other jails have to have a board if they're over 50 beds. Well, that's kind of been lost somewhere. So not all jails are having a board. They're having a grievance officer, and sometimes that appeals straight to a sheriff. So we want to clarify some language in that. So we kind of want to just change one. There's been some discussion between our staff and the field inspectors as well, that number 50 should possibly change to 96 instead of 50 because of the size. Even a 96 bed might have a hard time finding a board to get the grievance process going. But the language we're looking at, the only language change is in that number 1 area there where provide for the selection of a member or members to constitute a grievance board in facilities of 96 capacity or less. This may be one person. In facilities of 97 or more, a board of a minimum of 2 people will be selected. Inmate may also be a member. So We just want to clarify that anything over that has to have a board of some sort, because that's not happening right now.
My thought would be that that second sentence, which gives us a lot of flexibility, maybe it's not the second sentence, but it's the sentence that reads, it supplements but does not replace any informal grievance procedure. I know we really work hard to make sure most of our grievances are handled informally. A lot of times the grievance officer's going back there and talking about corrective actions and trying to come up with a plan to have an informal. So,
and I think that's where some of these, because we were seeing all kinds of different plans, Sheriff. We're seeing plans where you have an informal officer that goes out and tries to handle that. And then if the inmate doesn't like that, it goes to a board.
Yep.
That's the way it should work.
Yep.
And then if the board doesn't like the board's answer, it goes to an appeal process, usually the jail administrator or a sheriff or a chief. But we're also seeing where it goes, those larger jails, goes from that grievance officer straight to an appeal to a board. That's it. There's no other appeal past that. So we've just lost some clarification. That's all we want to do is try to clarify that 3-step process is great. But we still want to make sure that they're getting that board in there.
and my only other thought on this one is that if you're considering changing the number from 50 in that number one, item number one, that you consider going bigger.
144?
Yeah, something like that, because a jail with 96 inmates, they have 2 officers and a control room officer. The control room officer may be a dispatcher. And so it's hard to get 2 out of 3 when everybody's trying to work. So, yeah.
So do you want to go ahead and complete some language on that?
Yeah, I would like to work on some language a little better. And I also want to do a little more research on exactly where the board came from. I know Richard's researched a little bit, but to make sure about the increase in the number as well. So I did talk to the past executive director about this one as well. He said it was before his time. That number's always been there, but he thought it was in reference to a lawsuit at some point in the early 90s. So we just want to verify, make sure we're good with those numbers, and we'll bring it back to the next meeting to finish, finalize some language.
All right, that sounds good. And just to be clear, for some that may not be real familiar, if you take note of what actually constitutes a true grievance, because what we see a lot of times and historically have seen, the format in which those are submitted, the vast majority of those are actually fall under the category of a complaint. They didn't get something they were supposed to that was issued or whatever the case, but in order to actually meet the threshold of a grievance, it has to meet one of those four key items listed there. Then that would trigger the process that we'll see ultimately in writing, clarifying this out. All right. Anything else on your updated agenda that I don't? Item number 7, other business. I have one item of other business. Does anybody have any other business before I say proceed? Anybody, any other business?
Can I circle back to Dr. Robinson's?
You sure can.
Okay. I would just, in his suggestion, there's 4 separate items that he wants considered, and those impact, I think, primarily health, but then other areas of the standards. So I guess by opening my mouth, I'm inadvertently volunteering. I would like to, I think that some guidance to jails on notifications for people in the conditions he describes is useful. And so I guess if we try to take all 4 suggestions, I think it gets gummed up and we can't make any progress. But if we could pay specific attention to the notification item, I'd be willing to help or have somebody help with that, help draft that language.
I know who that might be too.
You?
All right. Get your Got that down. Thank you, Sheriff. Appreciate that. We'll have them take a look at that for their draft language. Any other business? One thing I wanted to bring up and potentially take action on today, as talked about earlier, we've got these two standing advisory committees. This one on the rules advisory side. We also have the individuals with developmental disabilities side. Just a brief bit of history on that. Obviously, the IDD advisory committee was put forward by way of statute. Had very specific requirements in there in terms of what members, who would constitute as sitting members of that committee, meeting requirements in that, which ultimately triggered the whole shift into a full adoption of open meeting requirements, minutes, so on and so forth, public comment. It's a sneeze, it is right there. So at that same time as we were putting those together for that, based on the statutes, we felt at the time it was smart to go ahead and formalize this group as well. And pretty well, with the one exception I'm about to say or mention, the bylaws, if you will, for both the advisory committees were almost identical, save one difference between this one and the other. There's a requirement in the bylaws for this group that the chair has to be a sitting member of the commission. No prohibition for a commissioner to participate in or on the committees, but for whatever reason, in this particular case, it was listed as the chair has to be a sitting commissioner. I think as most of you know, I was named chairman back last fall. Initially, I was kind of reticent to be holding that position, as well as be directly involved, especially the chair's position with regard to these, because we've got to, ultimately the entire commission has to consider and or adopt, take action on any and all recommendations that come out of these committees. But also, having said that, I feel like it also puts some limiters on this particular group in terms of, who in the future we may be able to have sitting or taking over, the chair spot. Don't anybody take this wrong, but I don't plan on doing this forever. But neither here nor there. I just feel like it would be a good thing to just go ahead and make sure we don't have the limit that we've got currently under the bylaws. And I would make a motion that we make a change to the bylaws.
We can't take action on this. It's not really part of the agenda. So we can do it next time.
But according to the bylaws, any changes to those come out of this group.
Yes, but any action that you take in this committee needs to be posted on the agenda, and it's not on here.
Well, then why do we have other business?
Other business should not be on the agenda. I don't know why.
Oh, really?
Yes, it needs to be more specific than that. You can't. So that discussion is okay, but we really can't take action.
Well,
sorry about that.
Then we will table that and get it on the agenda for the next meeting. Richard, do we have dates for the next meeting established yet?
Next meeting will be July 9th.
July 9th. All right. Does anybody else have anything for the good of the advisory committee?
Real quick, is that going to interfere with SAT? I don't remember the date.
No, SAT
It's after that, isn't it?
is the 18th, 22nd.
Okay.
We're
Just
good.
double check.
Yep, you're good. And it's good to check, but generally we're pretty safe. That's usually towards the latter part. So, all right, on that note, item number 9, I would ask for a motion to adjourn.
Make a motion.
Okay. We got a motion and a second out of that. All in favor? Aye.
Aye.
Any opposed? We are adjourned. Thank you again. Safe travels for those of you who have a trek to get back home.
Good to see everybody. Thank you. Thanks, docs.
Thank you.